I am Comanche Indian, and I come from a long line of nurses. 5 generations, as a matter of fact. My great-grandmother was considered a tribal healer. My grandmother was a nurse in the 1800s. My aunt, my grandmother's daughter, also was a nurse, a surgical nurse, for almost 30 years. I have 2 daughters that are also nurses, a NICU nurse and a labor and delivery nurse. And I am not only American Indian, but I'm also a nurse. So, I think my rich cultural heritage is one of the reasons that I have always been tuned in to cultural competency. I learned at an early age how important it was to understand your patients from their perspective. So, what is cultural competence? What does that mean? Well, I know you all are aware that you can go to 10 different books and find 10 different definitions of what cultural competency is. I think that, to me, it's a continuum. One end is cultural competency. Humility is on one far end on the left, and the far right is cultural competency, but with extreme acceptance on that end. So we've got extreme humility on one end and extreme acceptance on another. So what does extreme humility mean? Well, cultural humility was actually a term that was coined by 2 physicians in 1998, Teravalan and Murray Garcia. And they decided that they wanted to incorporate this in medicine. And it's come a long way since then. But cultural humility means that you sit down with your patients and you listen to them. You listen to them knowing that you're not necessarily the expert on health and illness where they're concerned, from their perspective, especially when they're culturally different than you are. It's sort of suspending, if you will, your own beliefs. You still hold them close, but you are not the expert on what their perspective is. So, when you're sitting down and listening to your patients, you're also learning from them at the same time. That's one of the most important pieces of that humility piece. You're also humble enough to say, I don't really know the answer to your question, but I'll find out. On the other end of the spectrum, you have, as I said before, extreme acceptance. What that means is you suspend your own beliefs, hold them close, but you don't abandon them by any means. You just hold them close. It means you learn to respect differences that you're going to encounter in your career. It means you embrace tolerance and acceptance. So, as you can see, if you move from one end of the continuum to another, you are moving towards cultural competency. I want to tell you a story. When I was first out of nursing school, I took a job in the ICU. I'd been working there for several months, went on vacation for a few days, came back, and was sort of catching myself up on the patients in the unit and what my assignment was going to be. And the nurse that gave me the report just said, you'll be having taking care of an elderly man tonight that is terminal with cancer. Doesn't have much longer to live. His family is here, they're always in the room. His wife is always at his bedside. His 2 sons are there and their wives, and they come and go. There's only one thing I want to tell you specifically about them, though. The nursing staff has noticed that every time they go into the room, everything's messed up. I said, okay, well, wonder what that means. What does it mean? Tell me more. What does that mean, messed up? I said, does it mean they're leaving their food out or their newspapers everywhere? What does that mean? She said, oh no, nothing like that. It has to do with moving furniture around. They keep moving equipment around, moving chairs around, moving the bed around. No matter how many times the nurses have said, this is not a good idea, we need the equipment where it's located for emergencies, et cetera, it made no difference. They'd come back in a while after they had gotten everything orderly again. And you know how we are as nurses, we're very orderly. We like things just in the right place. Have you ever watched a nurse or yourself start an IV? You tear 4 pieces of tape that are 4 inches long, 3 pieces of tape we line them all up on the bedside table so that we can get access to them. We just are orderly by nature, I think. So this was really frustrating to the staff, that every time they came into that room, it was in disarray. I said, okay, thank you for telling me. I'll, see what I can find out. So I went in, introduced myself, checked on the patient, and then I asked her if I could come back in a little while and sit down and talk with her, that I wanted to get to know she and her husband a little bit better. She said yes. I went off. 30 minutes later, I came back, sat down with her, and we just did some superficial chit-chat in the beginning. I asked her some questions about her family. She told me that she and her husband had moved here 3 years ago, and they were living with their sons. So, out of their comfort zone here in the United States, especially with the healthcare system. So I just continued to listen as she talked. And when she was finished, I said, I have a personal question to ask. The nurses have told me that they have noticed that you all moved the furniture around a lot in this room. And she looked at the floor for a minute, and she looked back up at me, and she said, there's a reason for that. I didn't say anything, I just listened. And she said, we're Muslim. In our belief system, a person that is dying, we have to ensure that they're facing west, the direction west. So that's why we've been moving the furniture around to make sure that my husband's bed is pointing west. And the reason for it is we believe that that's where Allah is waiting, or God, to take our loved one across. So I sat there for a second and I thought, this makes perfect sense to me, why they have been moving the furniture around. So I thanked her. And I said, I'm really glad that you shared this information with me. If you don't mind, I'm going to share it with the staff so that they can stop giving you looks and moving stuff back around, and everybody will understand what's going on. She said that would be wonderful. I discovered in that instance that even the smallest thing that you can do for a patient that is different than yourself, it becomes so appreciated by that person and the family. So, in that context, that was really about humility, extreme humility. I sat down with her, I listened to her, I learned from her, and then we made adjustments and accommodations as we could with that family. Let me tell you another story. In the 1990s, I was a faculty member, and I had students in the labor and delivery area. And when we got report that morning, now remember, this was 30 years ago, a totally different time and place. So when we got report that morning, we were told that we had a couple in labor that happened to be lesbian. So the staff was, sort of taken back, and from the comments, there was some not only reluctance to care for the couple, but resistance as well. Probably, thinking back about it now, more out of fear of the unknown, so to speak. So, 2 of my students decided they volunteered to take care of the couple. So we left and we went out in the hallway, and I said, okay, what's the plan going to be? And they were sort of overwhelmed by the whole situation at that point, and I said, okay, why don't we just start out by treating them as a normal laboring couple? Because that's what they are. We went in, did our job, became very close with the couple. They were delightful. They had the same questions that any new parent that's in that situation has. What's going to happen after the delivery? How long will the baby get to stay here? Goes to the nursery, when do we get it back? Those kinds of questions. The same, what's going to happen with my partner? Where is she going to go from here? Same questions that anyone else asks that's in labor. So they gave us one of the most meaningful experiences probably in my nursing career. because they were so overjoyed when the baby arrived. We got to see the delivery, the birth. The students were crying, the nurse was crying, I was crying, the parents were crying, we were all crying because they were so excited about the birth of this baby. So it was, as I said, one of the most meaningful experiences that I had had to that point. So that's a situation of going towards the opposite end of the spectrum or the continuum where you become accepting. So these are some of the stories that I have had through the years and experiences that I've had that have led to stories. So I just thought I would share those with you as examples of the continuum that I've been describing of cultural competency. Now, we're going to develop yours. I'm a teacher. You all knew this was going to happen, didn't you? Yeah. It's bound to happen when you've got a teacher in front of you. Okay. I'm not going to ask you to do anything except think about some things. So, back to the continuum. Let's look at it and just understand that the further right you go, the more culturally competent you become. So, I want you to understand that there will be situations that happen in your career, patients that you will encounter that you were not anticipating, and you will just be thrown for a loop. It will happen, I guarantee you. It happens to all of us. But you've got to decide and figure out in a nanosecond what your response is going to be and how you're going to proceed. So, let me give you some situations. I don't want you to say anything. I just want you to think about them. First of all, where do you think you are on the continuum at this point in your career? I know a lot of you are students, but some people bring other experiences to school that could certainly add to this. So do you think that you're on the far end, that you're still at the point of discovering what you believe yourself and what you hold dear to you and what you can suspend? Are you at that point? Or have you had some cultural humility already going on with your patients, where you've been sitting down, talking to them, learning from them, making some accommodations for them as much as you can? So just decide where you are on the continuum. So I just want you to think about that for a second. Once you sort of have that in your mind, the next thing I want you to do is I'm going to give you a situation, and I want you to think about very quickly what you would do in that situation. Let's say you came to work and you were told that one of your patient assignments was a patient that was HIV positive. What would you do? How would you be thinking about that situation? Now think about, you come to work and they say, your patient tonight, one of them is going to be a transgender patient. Think about that. How would you react? How would you respond? What would be your plan? Or you came to work and your supervisor said, one of your patients tonight is addicted to opioids. What do you think about working with an addict? These are things you need to start thinking about. These are just some examples. Think of other ones. Since you're still students, think of other scenarios that you think would just totally take you back, and you'd really have to take pause when you heard the type of patient you were going to be taking care of. I think that these are all tough questions, but if you can give yourself some practice ahead of time, it makes it easier when the surprise happens and you walk in and find out who you're going to be taking care of for 8 hours or 12 hours. So what I want you to realize is that cultural competency is not about race, ethnicity, gender, politics, morality. None of those things. None of those things matter. What's it about? It's about patient outcomes. You want to be culturally competent to produce better patient outcomes. You want the patients to have a meaningful hospital experience. So how do you help them do that? Especially when they are different than yourself. You know, one of the big questions is, how do I feel about taking care of someone that's different than I am? You have to answer that yourself. Nobody can answer that for you. The bottom line is, it's about openness and acceptance. Every single day with every patient you encounter. Thank you for your kind attention.